Hello everybody. Happy Saturday. How y'all doing? Today we are talking on disenfranchisement in the area of infertility, disenfranchised grief in the area of infertility. I got this idea when I had to type a 12-page paper last night. That's why my eyes are swollen like this. I had to type a paper on disenfranchised grief and infertility. And so I channeled my project to infertility in Nigeria, specifically infertility in Nigeria. So call your friends, share this live broadcast, share it. Hello everybody. I'm just going to wait for y'all to come in. Hi Asia. Infertility. And I hope that y'all know the people who are not married and people who are single. And there are some people who actually do want to have kids when they're single, like they shouldn't. But some people want to. And they also go through disenfranchised grief because they don't have the full package. You know, they don't have the husband, they don't have all of that. So it's disenfranchised. Okay, so that's what we're going to be talking about today. Infertility, especially in Nigeria or with Nigerians. Infertility. How everybody thinks that infertility is a woman problem. It's a men problem too. How religion also plays a big role. I'm just going to wait for y'all. And remember that I'm going to randomly choose shout out to somebody live. And we're going to have a conversation, okay? Hi, Nathaniel. How are you? Candy, how are you? Awesome. I'm just going to wait on you guys. So, as I'm waiting, I'm just going to remind you that you can register for my emotional healing school. We start in June. It's for 3 months. It's online. Please join. For your benefit, we're going to be talking about generational patterns, fragmentation, mental blocks, low self-esteem, not knowing how to get back to your passion because you've been away from it for so long. Like we're going to be teaching a lot of things. It's only $20 for 3 months. $20 for 3 months. In January, it's going to go back to its full price, which is $100. Okay, so you can inbox me if you're interested. We have a lot of students already who have done that. So disenfranchisement in grief. I'm just going to wait for more of you to come on here. Let me tell you a COVID experience I had 2 weeks ago. When I went to work, I'm all guarded. I'm wearing my mask. I'm wearing everything that I should wear. But when I went to the section of the COVID patients, you know, I was just crawling in like, oh my gosh, let me be careful. And so I was there what was I doing with this patient? Yes, I was trying to clean snort off of his nose and out of his mouth. And he had such a bad cough, like he couldn't even cough. You know, he was a COVID patient. And I pray to God that he's still there. Like I'll be going back to work tomorrow and I pray to God that he's still there. And while I was trying to be careful in helping this man, the Holy Spirit told me, you are fully armored. Okay, you have me and you have on your gear. So you're going to do this work or you go home. That was exactly what the Holy Spirit told me. You do this work or you go home. That's what he told me about my COVID patients. You do this work or you go home. I have called you to do this now. So you do the work or you go home. You can't do it half baked. You can't be haphazard. When God tells you to do something, you got to throw your whole self in. So he said, you throw yourself in, your whole self in, or you go home. And you know what? My perspective changed completely. Hello, Abimbola. My perspective changed completely. And I started to help my COVID patients like the way I would help my dad or my mom. Like, I went all the way in till I got sick myself, you know. But that's what God is looking for. He's looking for your obedience. So I am still waiting because this is such a good topic. Infertility, disenfranchised infertility. So I'm just going to go ahead. What does disenfranchised mean? For something to be disenfranchised in the area of grief, it means that it's not recognized. Okay, it's not recognized. So let me give you some examples. Let's say like a second wife. A second wife loses her husband. And no, not a second wife. Let's say a concubine or like a girlfriend. But I'm not just talking about like a trick or something. Like I'm talking about like she was a girlfriend. Yes, he had his wife, but she was a girlfriend. Like she had been with this man like for 20 years. You know, kind of side chick. And now the man dies. So when he dies, of course, her grief is disenfranchised because, I mean, it's not like anybody is going to be visiting her. It's not like anybody's going to be calling her. You know, so that's what disenfranchised grief is. It's not like anybody is going to be calling you. You know, so you're going through your pain privately, and it's very, very painful to hurt privately. Okay, so infertility and disenfranchised infertility, especially with African Americans, especially in Nigeria. Okay, so first of all, y'all have to know, you know that I have been married for 8 years. Now I'm in a place of contentment, okay? I am in a place of contentment, and I would never forget. Hello, Rita. How are you? Tijani. Hi. I would never forget. Hi, Lillian. I would never forget when somebody told me, when I said that I'm finally in a place of contentment because I had been trying to conceive for so long. Hey, Esther, I had been trying to conceive for so long, and I said, I am finally in a place of contentment. And this person said, you should not be in contentment. No. That is not the will of God. The will of God is not for you to be in contentment that you don't have any children. No. The Bible says that you should be faithful and you should multiply. Be faithful and multiply. Do you know the error? And first of all, I know that this person did not mean any harm, but do you know the error when you tell people who are trying to conceive, the error of telling them to be fruitful and multiply and don't be content? It's now you are telling them that they have to keep on trying and that the power is within them. You know, they should probably stop having sex for 10 minutes. Maybe they should just have sex for 3 days straight. You know, you're just not having sex enough. Yeah, that's what it is. Hello, Brother Matthew. You're just not having sex enough. You should just have sex for like 1 straight week. Maybe God will answer you then. This is what you're telling people when you make statements like be fruitful and multiply and don't stop trying and there's no way that you can be content. And this is what this person told me. But the truth is that I was content. Do you know why I was content? Because I had done all I could have done. People who know me personally, they know that I have done an IUI. I have had a chemical pregnancy. If you don't know what that is, you can go Google. I have had a chemical pregnancy. I have done IVFs. I have had over 50 injections stuck in me. I have had overstimulated ovaries to where I looked like a 9-month pregnant woman. And people were like, oh my God, oh, when are you due? But it was from the effect of the procedures of IVFs, and I was off Facebook for a while because I couldn't show you guys those pictures. I couldn't show you guys how swollen my face was, how big my legs were. So now that I have gone through years and years of trying to conceive, I've gone to different countries, I have drank all kinds of things, I have climbed mountains, I have prayed, I have cried, I have done all of that. Now you tell me not to be content? No. That's not right. So it's safe to say that for those of you who just lean on a tree and y'all get pregnant, like this segment is not for you. This segment is not for you. This segment is for people who have been trying to get pregnant and you know what it means for church people to talk about you, your family to talk about you, in-laws talk about you, even the cat and the dog are talking about you. And you also know what it feels like for people to keep thinking that this is a women problem. No, infertility is on both. It's on both spectrums. You will not get pregnant on your own. Okay? And churches need to also stop perpetrating this thing. So let's go. Now, I remember when I did my last IVF, I was bleeding. I mean, it was like somebody had turned on a tap. And it was what they call a failed IVF. And this one was for 3 embryos were implanted in me. They were my embryos, me and my husband. And it was not a joke. And I lost them because they didn't implant into the womb. And there I was bleeding and bleeding and bleeding and bleeding. And who do you tell that type of thing to? People don't even understand. You know, people don't even understand when you have a miscarriage. I will never forget when I had my first miscarriage. Hi, Christiana. Hi, Frank. I would never forget. Hi, Pius. I would never forget when I had my first miscarriage. And it was a chemical pregnancy. I went to the hospital and I was holding my belly and I was screaming and I was crying and this nurse was like, madam, now, the way that you got the first one is the way that you will get the second one. She did not realize. She didn't realize that I wasn't crying because of the miscarriage. I was crying because of how long it took for me to even get pregnant. That's why I was crying. That's why y'all have to be careful when you talk. You don't know what people are going through in closed doors. Maybe you're not trying well. Maybe you're not trying enough now. My sister. There was a day that a pastor called me after church and he was like, it's your high heel. If you just stop wearing high heels, you will get pregnant. It's your high heels. Stop wearing high heels. Sister Omenesa, always wearing high heel. Don't wear high heel. Okay, look, I am in the medical field, so I do know that high heels do tilt your uterus. I get it. But wearing high heels is not the problem of infertility. Okay. So let's move on. So number 1, Michelle Obama, former First Lady of Nigeria. Michelle Obama had her baby. Had her twins. Lillian said, seriously, high heels. Well, wearing high heels tilts your uterus, but it doesn't cause, I don't know if it causes infertility, because infertility is a big word now, you know, but it does tilt your uterus, especially when that's all you wearing, okay? Anyway, Michelle Obama had her 2 children via an IVF because she had a horrible miscarriage and then she had an IVF. Why didn't she mention this? Like, she didn't mention this at all when her husband was in administration because of the stigma that comes with it. She also said in an interview, it was either on ABC or CNN, and she said that she felt like she had failed when she did do the IVF because, like, people don't talk about those things. That's what she said. People don't talk about those things. When people start talking about these things, when people in the government, those of you who are pretending like those children are yours, like in the government, like I'm talking about people now in power. Those of you who go and buy kids, yeah, and then you walk around making people feel like marginalizing people, you know, because they don't have the money to do that, you know. They don't have those kind of connections. I'm not saying that there's anything wrong with that. Like, there's nothing wrong with surrogacy. There's nothing wrong with adoption and all of that. But when you walk around making people feel like you're better than them because now you've got twins or now you've got triplets, how about one day, like, how about somebody just wakes up and tells your story? Like, you're not going to like that. Rather than us going around covering this thing about infertility, we are the ones who are making it worse. And that's why I talk about it. I talk about it because I don't want the stigma to continue. The reason why we have a stigma with infertility is because we don't talk about it. Nobody's talking about it. You know, I was shocked when I saw an ad the other day. It was an HIV ad, and this guy was like, I mean, like, he was well dressed, and he was talking about like a pill or something for HIV, and he was smiling, and I was shocked beyond, like, I was like, whoa. I mean, like, that's a lot of confidence, because they weren't using actors. This was somebody who actually has HIV, you know? It was, and I was like, wow, that was a big deal for me. If people who have infertility issues, hi Williams, if people who have infertility issues start talking about it, not like it's a problem, but like it's there, like autism, you know, like a headache. It's there. It's there. If we start talking about it, then the stigma would stop. Number one, infertility is when you have had consistent sex, consistent lovemaking, consistent intimacy for one solid year without protection, and you still don't get pregnant. Okay, that's what infertility means. Number two, children are a gift from God. Okay, children are a gift from God. And God decides when you will have that gift, if you should have that gift. You see how we walk around in this world and we walk into malls? We don't go around buying everything. We don't do that. You know? God gives us what we need at that time because he sees the end from the beginning. He sees the beginning from the end. And this is why I became content with infertility. Being content with infertility does not mean that I don't want to have kids. No, being content with infertility means whether God gives me, whether he slay me, whether he gives me or not, I'm still going to serve him, and I am not going to lose my mind over it. Because guess what? I have kids. My purpose and my goal. My purpose and my goal in life is my child. Do you understand? So this whole thing about disenfranchisement, looking down on people because they don't have kids, or making insensitive statements, you are making people with infertility feel very, very uncomfortable. You're making them kill themselves. Okay? So let's stop. Nigerians especially, y'all need to realize that your successor does not have to be from your loins. Ooh, hi brother Kevin. Your successor does not have to be from your loins. Okay, there's some of you who have children and you entrusted them with your company, you entrusted them with your ministry, and they messed it up. They disrespected all of your staff. They completely discombobulated everything that you had built for 30-something years. So the fact that you have a child does not mean that they're going to run your business or there will be longevity. This mentality with Africans especially, it needs to stop. Your successor does not have to be from your loins, especially those of you in the village. Stop, like when people get married and then you tell them, 9 months from now. 9 months from now, stop it. Stop it. Because I know Nigerians who don't even want children. And, oh yes, and for those of you who keep saying that to not want children is a sin, it's ungrateful to God. No, it's not. There are some people who just know that they can't take care of kids. Some people know that they can't handle the cry. Some people know that they are not emotionally available to take care of a child. Some people know this, and it is not a sin. It is not a sin, okay? Now, infertility is also a male problem. It's also a man problem. Men also go through it. Do you know why you don't know the men go through it? Because they're marginalized. Because nobody is talking about it. Because when they go and watch games, hi Rosalind, when they go and they watch games, when they go out with their friends, you know, and all their friends are talking about kids, you know, they don't know how to act. You know, because it does something to their ego. Like they feel like they can't meet up. Like some men, like they can't even like produce sperm for an IVF. You know, it's a serious thing. Reproductive loss is saying goodbye to someone that you've never said hello to. My husband and I know this so well. Losing an twins from an IVF triplets from an IVF because it was a failed IVF. We went through the same emotions. And then when I had a miscarriage from a chemical pregnancy, we went through the same emotions. And to the defense of many people don't know how to encourage people who are going through infertility. Now, here are the things that you should not say. God's time is the best. God's time is the best, my sister. Why don't you just adopt? Or why don't you just adopt? You know, when you adopt, God will give you your own child. So what is the adoption for? An experiment? What is that? Like you're trying to bribe God? Those statements are just unnecessary. If you adopt, God will give you your own child. No. If you want to adopt, it should be something, it should be a plan A. It should not be a plan B. No child deserves to be a plan B. If you want to adopt, it should be a plan A, not a plan B. If you want to adopt, that means that your emotions, you have to completely mourn your desire to have a child from your own womb so that it wouldn't interfere with that adopted child. The emotions are very, very powerful. You don't adopt a child to augment. You adopt a child because you are called to adopt a child, because it is a ministry. So you don't adopt a child because you want a child. No, you adopt a child because you are called to adopt a child. So those of you who keep saying, why don't you just adopt? Just adopt a child. No. The emotions will come. The emotions will, no. I will not gamble with a human being's life. Because you don't even know if your emotions are intact before you go take. I hope you know that when you adopt a child, you are taking on a ministry. Kudos to people who have adopted children, because that is a ministry. That is bigger than birthing your own child, because that's a ministry. You went out of yourself. You went out of your finances. You went out of your way. You went out of your way. Hi, Gloria. Those of you who are trying to have kids, keep on trying to have kids. Keep on praying. But please do not allow your identity to be personified and to be labeled by this condition. And I shouldn't even say that word, because infertility is not a condition. Infertility is just a thing. It's just a thing. It's just a thing. Okay? Please, y'all need to stop saying stuff like, children are noisy anyway. You don't even need kids. Sometime last week, a woman said, you are so young. I can't believe that you've been married for 8 years. I said, yeah, I've been married for 8 years. Wow. Do you have children? And I said, not yet. Like, I've lost a couple of pregnancies. Maybe God doesn't want you to have children. Can you people stop saying stuff like that? Like stop. So God wants you to have children, but he doesn't want me to have children because you're better than me, or what? What? Can you see how that statement sounds? It's not a good statement. Don't say that. Okay? Stop. Stop worrying. Just relax. Children will come. The problem with these statements is that now there's an expectation on the mind of the people trying to have children, and now they're waiting for the children to come. They're having sex for 72 hours straight. They can't even walk anymore. I'm talking from experience. You don't even want to do it anymore because you're doing it for something. Lillian said that they need to be sensitive. Girl, a lot of people don't know how to be sensitive, especially when you haven't fought for something, when you haven't worn the shoe of something. You don't know how to be sensitive because you've never been there. So it's something that we have to practice. I don't believe that you have to go through a situation in order to be empathic. It's something that you have to practice. You can always do IVF. Do you have the money to give me? Can you give me money? Can I use your children's savings account? How about you give me that money? Okay. Just adopt. Stop wearing high heels. Maybe you're not meant to be a parent. I've heard that before. Somebody has actually told me, with all of your traveling, how are you supposed to have children? Okay, hello, sir, ma'am. So when I travel, if we want to be realistic, to have sex, is like, if you're trying to have a quickie, about 5 to 15 minutes, 30 hour max, maybe an hour. Okay, so if I'm traveling, right, and sex is for only 5, 15, 30 or whatever minutes, like, how does that even rhyme? How does that rhyme? And then you ovulate one day. You ovulate one day a month. So how does my traveling affect my infertility? Shut up. Shut up. When you don't know what to say, especially to people who are dealing with infertility, let me tell you what people who are dealing with infertility go through. They go through anxiety. We go through fear. And I shouldn't say they. I'm sorry, because I am dealing with infertility. They go through anxiety. They go through fear. We go through fear. We go through anger. We feel inadequate. We feel uncertain. We worry. We regret. And sometimes we go through depression. Sometimes we go through depression. And then you wake up because you think that you're trying to encourage me, and you say stuff like, stop traveling. Stop wearing high heels. God's time is the best. Maybe you should adopt. Maybe God doesn't want you to have children. You don't know how long I cried last night. You don't know how I've been tracking my cycle. You don't know how many countries I've been through trying to have kids. Half of those countries I travel to. Do you know where I go? Do you think I post everything on Facebook? Don't talk to people like that. Don't do that. And that's why I started off by saying that for those of you who just lean on a tree and you get pregnant, you're not going to understand this segment. This is for people who are trying to have something that is normal. Do you know what it feels like? Do you know what it feels like to be trying to have something that's normal? Something that your workers are having, something that babies are having. 14-year-olds are having babies. Do you know how painful that is? Stop. Maybe you're not meant to be a parent. Oh, you are so young. There is time. You don't know my plans. You don't know what I've planned. You don't know if I'm dying from some kind of disease and I really want to have children. So don't say that. When you're putting your career in front of you, how do you want to have children? Who told you that? Who told you that? It's your mind. When you rest your mind, you'll be able to have kids. Oh, cheer up. It could be cancer. I would like to say that my mother died without being a grandmother. Okay. My mother died without being a grandmother. And this is one of the things that people who suffer from infertility, these are one of the things that we struggle with. This is one of the pains that we go through. Is the expectation that we have, the expectation that other people have. We mourn not having a baby shower. We mourn not being able to carry our children with us to your baby's birthday party. And for the person who sent me a message years ago that she's about to ovulate and tonight is the night, don't send me that kind of message. Don't send people who are dealing with infertility. Don't tell us that you are ovulating and tonight is the night. Stop. No. I don't need to know that. Okay? Now, if we're friends, and we're really, really good friends, of course, that's not going to bother me. Okay, surrogacy and adoption. These are very, very steep decisions, and they should not be made based on your emotions, okay? These are choices that should be God-made. You shouldn't make that choice when you're going through an emotional upheaval. No. Okay? I don't see surrogacy and adoption as an option. I see it as a ministry. Options to me are like an IUI, like an IVF, and there's so many other things. I would never forget when I traveled to India. I could not believe the hundreds of men and women waiting in line just to have an ultrasound for for infertility. I could not believe it. I was like, wow, this is really a big problem. Your identity should be separated from this condition. Okay? So I have already told you what infertility means. And then the types of infertility. We have primary infertility. That's when you've never been pregnant. You haven't had any children. And then we have the secondary infertility, which is when you've had a child before and now you can't have another child, or you're finding it hard to have another child. You go through grief as well because it's frustrating. Oh my goodness, why can't I have another child when I was able to have a first child? And then for somebody who has a primary infertility, like they're hurting because, hello, why can't I have any children? And then their pregnancy, there is infertility that is unexplained. Like there is no reason, but there are some reasons, okay? Infection, toxic exposure, ovulation disorders, tubal obstruction, uterine abnormalities, ejaculatory problems, alcohol, obesity, diabetes. The list is long, okay? So when you don't see people having children, don't give unsolicited advice. Trust me. People who don't have children know that they don't have children. You don't need to remind them. You don't need to remind them. And those of you who are trying to find out if people have children and you say, so how are the children doing? How are they? Stop. We know. We know all of those gimmicks. We know all of those gimmicks. Stop it. Okay? Stop. Now, so back to disenfranchised grief. Grief that is not recognized. And I gave you an example. It could be being a second wife, being a concubine, the LGBT, being gay, and your spouse dies because it's fully not accepted yet. People are not going to understand that. Lillian said, say that again. People are not going to understand why you're crying over your spouse because they haven't accepted you yet, right? Having a miscarriage is disenfranchised because you see, when you bury a parent or you bury a brother or sister, you have a funeral, right? People call you, people send you gifts, people send you flowers. You even get a leave of absence at work. But when you have a miscarriage, people don't talk about it. You probably don't even tell anybody. So you still go to work. You're still dealing with all of that emotional weight. People don't have a funeral. People don't have like some kind of party. Very few people call you, and those are the people who you told that you had a miscarriage. So you go through that pain alone. So I want to encourage those of you who are suffering from infertility and those of you who are onlookers. Let's be talking about it. Talk about it. The same way that we're talking about paralysis and autism and all of that. Talk about it. Be free to talk about it. How are the children? There was a time in my life that people will ask me, so how are the children doing? And I'll be like, they're fine, thank you. And in my head, I was trying to have faith that I have children. But the Holy Spirit showed me. He said, no, you are insecure. You're insecure. You feel bad that you don't have children and you don't want to open that door up. You don't want to open it up. So when people ask you, so how are the children doing? You say that they're fine. Stop lying. That's a lie. The children are not fine. The children don't exist. They don't exist. So now when you ask me, so how are their children? I don't have children. I don't have children. Madam. Sorry, don't worry. God will give it to you. I have 5 children. Oh gosh. I would never forget when I went to minister. I went to minister somewhere. And this woman asked me, so how many children do you have? And I said, I don't have children. She said, Shami, I have 5 children. And then I was so young in my faith. I was so young in my, emotions. So her telling me that she had 5 children. Hi, Ethel. Her telling me that she had 5 children, it really hurt it really hurt me so bad. I remember I called my husband, what type of nonsense is this? People can be so insensitive. Look, those of you who have had miscarriages, those of you who are trying to have children, keep on doing what you're doing, okay? But please be content. You have to mourn the fact that you may not have children. Hi, Rose. Mwah. You may not have children, okay? And please, okay, so now let's go to the religion aspect. I don't have a problem with surrogacy whatsoever. I know people who do surrogacy. I understand it, but do you know what I have a problem with? I have a very, very big problem with people who come for Thanksgiving. In Nigeria, we call it Owambe. You are 50 years old. Everybody has been has been praying for you. Everybody has been praying, shataraba, for you. People have been holding vigils for you. And then you come on Thanksgiving Day and you dance with triplets and you are 50 and you don't even tell people your testimony. Now, there was somebody who told me that people don't owe you an explanation. I understand that. But this is also part of what's causing the marginalization. This is part of what's causing the stigma. Why can't you just tell people that you had the children through surrogacy? Why is this an issue? Like I know people who personally travel to different, I'm talking about countries that you don't even know are on the map. I'm not talking about America or Dubai. I am talking about some deep countries, y'all. Like they go to some countries and they sit down with somebody for 9 months and they do this surrogacy thing. I'm not talking about the people who are the surrogate now. I'm talking about people who are 50, 60, and then they stay away from the country for so long. And then they come into the country and they try to make everybody feel like that baby is theirs. Yes, the baby is yours because the eggs and everything is yours. But I think that the stigma will stop if you can stand on Thanksgiving Day. Imagine what it would be like for a Nigerian couple in a Nigerian church, maybe a Redeemed Church or Mountain of Fire or something. And you stand in front of everybody and you say that God blessed us with a surrogate because we had tried to have children, and God blessed us with a woman who carried our baby for 9 months. And let's just take 5 minutes and just pray for this woman for carrying our baby for us. It would change many things in Nigeria. It would change this stigma. But we don't do that. We go and we dance and we do Thanksgiving and we make everybody think that those triplets came from us, and we traveled and we got pregnant in a different country and then we came back 9 months later. Come on, y'all. Come on. Y'all have the right to do whatever you want to do, but to me, you're part of the problem. To me. Now, I also know people who have done surrogacy and they tell people. They flat out just tell people, this is not something that should be hidden, It's not. Lillian, yes, I agree. Now, another thing is there are some churches who don't believe in IVF. Some religions don't believe in IVF because they say that intervention is a sin because children are a gift from God. So when you do an IVF and when you do an IUI and when you do all of this, you're trying to help God. That's what some people think. You are trying to help God. I'm sorry, my battery's low. You are trying to help God. So it's a sin. Okay, if it's a sin to have children, then why don't we please stop saying on the pulpit, be fruitful and multiply? I'm just saying. Don't shoot me. Pastors, if you don't want us to do IVF and IUI because it's a sin and we're trying to help God, then please stop telling us to go home and be fruitful and multiply. Because this is putting pressure. Can you see how this is putting pressure on us? Yes. Anyway, it's not putting pressure on me because I happen to be from the denomination that believes in IVF and IUI. But I feel sorry for for the people who their denomination does not agree with IVF and interventions. I'm sorry, yes, it will be. Yep, Esther. Another thing, pastors, please, y'all, please. I know that in Nigeria, there's a lot of witchcraft and voodoo and all of that. Trust me. I understand that, and I know that. I do believe that witchcraft is real. I do believe that there's a lot of that in Nigeria and in other countries. But it will be nice that we always think about science first rather than juju, or rather than oh, somebody's out to attack you. Somebody wants to kill you. Your great-grandmother has tied your womb in the village. Hi, Tronda. I'm not saying that that's not what's happening, but that shouldn't be the first thing that we are talking about. It could be unexplained. It could be unexplained. Hi, Jessica. It could be unexplained fertility or infertility. It doesn't have to be witchcraft. So when we go around and the first thing that we talk about is witchcraft, people now start feeling like, oh, maybe God is punishing me. Or because if we also say that God will not allow a curse to come upon you if you live right, if you're a Christian and you believe that, when people tell you that you can't have children because of witchcraft, hi, Megan, when people tell you that you can't have children because of witchcraft, then that messes up with your spirituality. This is why we need to be careful with the things that we're telling people who are trying to conceive. Okay? Because then you are disenfranchising their grief. Like you're trivializing it. You're minimalizing it. Girl, I'm going to put somebody on camera. Like I told you, I'm going to have a random special person on camera. Okay, so you're disenfranchising. Hey, Pay. Girl, I love you. Thank you so much for being here. Okay, so disenfranchised grief, again, disenfranchised grief is when you don't recognize the pain and you don't recognize the grief from somebody. Okay? You don't recognize the grief or the pain from somebody, okay? Okay, so back to pastors. So if pastors could have like support group, if churches could have support groups for women who are dealing with infertility, please, it will be nice. Pastor, once again, let me suggest. Pastors, please stop announcing. For those of you who are looking for the fruit of the womb, all of you should come out. Thank you. Thank you so much for praying for us. But men don't have wombs. So when you say the fruit of the womb, we know what you mean, okay? But then, have you noticed that a whole bunch of women come out? A lot of men just sit down because they don't have wombs. Couples who are trying to conceive, we are praying for you. Why don't you start like a fertility fund in your church? Have you noticed that a lot of churches have support groups for everything? They have a group for this, a group for that, prayer group for this, and prayer group for that. Hi, Ethel. Prayer group for this and prayer group for that, but they don't have a prayer group for fertility. A lot of churches don't even talk about infertility, but you need to see them when it's time for Thanksgiving. Woo! Oh, I'm bad. I don't have a problem with the oh, I'm bad, but can we pray for people? Like, can we have support groups for people who are dealing with infertility? Can we stop saying, because the way it sounds, pastors, to some pastors, it sounds like when you go up and say, those of you who are looking for the fruit of the womb, it sounds like, okay, so you've put a check mark there, so at least you care. But what about actually caring about the interventions of fertility? Maybe the church should have like a fertility fund to help their church members, with their fertility issues. Maybe we should have like a mobile clinic in front of the church where men have sperm counts yes, churches should start talking about this. Because if you're going to be bold, pastor, to tell me that I can't have an IVF because I'm interfering with God's plan, if you are going to be bold to tell me that I should be fruitful and multiply, and you're not helping me to be fruitful and multiply, don't talk to me. Don't talk to me. Stop. A lot of people easily talk like this because once again, they just leaned on a tree and they were able to have children. So they don't understand. Okay? So please help these people. Those of you who go out for Thanksgiving and you did surrogacy or you did an IVF and now you have 4 children and you're 50 years old. News flash for you. A lot of us know that you did an IVF. A whole bunch of us know. Tell people. Say it. Announce it in the church. Yes, you have your right not to announce it, but you're adding to the stigma. You're adding to the problem because now people are going home thinking that, oh, okay, that means that I could be 60 years old and have a child. So I'm just going to keep on praying till I'm 50. That's not fair. Before I leave you today, I'm going to tell you, after I had IVFs and IUIs trying to have a child, having sex for 2 weeks straight, I was just done. One day I went to church and I was swollen. I was huge from all of that medication. I was huge. If infertility is bad, then they should not be eating healthy secretly. Exactly, Lillian. I was huge. And somebody in my church, her name is Jane Akwani. She is a fabulous writer. She's a voice in Nigeria. She called me aside and she said, because people call me Meme, those who really, really know me, like my kinfolk. And she was like, Meme, I am so sorry. And she said, it is not fair. Ifoma, hello girl. It is not fair. You are trying to get pregnant and your shape is changing because of all these medications and it's not fair. That's the best thing anybody has ever said to me. Because that made me know that she saw me. She saw me. She didn't see a condition. She saw what I was going through. The pain of trying so hard to have a child. So, number 1, Michelle Obama had her children from IVF. You can have an IVF if you want to. It's okay. For those of you who didn't know, an IVF now is covered in insurance if you're in New York City. I think that there are some states too. You can always travel to India and travel to all these other countries and Nigeria and all of that. But in whatever you're doing, please realize that your successor, especially for Nigerians, listen, your successor does not have to come from your loins. Because your children could get up there, get into your business and mess up everything that you built for 40-something years. I have seen it. And then a stranger, a stone that the builders rejected, will completely glorify your business. So don't have that kind of mentality. Africans, like, we need to stop. Let's not have that kind of mentality. I am looking for somebody to ask. Let's not have that kind of mentality. There is somebody who I'm trying to call here before I leave. Please answer the phone. Let's not have that kind of mentality. Okay? 20% to 30% of infertility also affects men. Okay, so everybody who keeps focusing on the women and how she needs to have a girl, or men who are not going for infertility counseling, you are hurting yourself. Because let me tell you something. When people see that a woman is always in the hospital and she's trying to have children, do you think that people don't know? Like, do you really think that people are not thinking, ooh, maybe it's him? Moving on. Okay, so that person is not answering. Who else can I call here before I close out? Remember that I give a special shout out to somebody on here. Who can I bring on camera? Okay, so please, statements not to make. God knows best. Maybe you shouldn't be having any children. Children are a headache. My sister. Oh, so if children are a headache, I want to have that headache too. I want that headache too. So don't tell me that. Pray for me. Now, what are the things that you should tell people? Hey, I have to go, y'all.